we think is normal is really just common in our own experience. So many of my clients, when I was teaching cycle charting, would begin charting with me, and after a few cycles, I would start to recognize a pattern indicating a potential abnormality. I would point this out to them, and many times my client would say, "But I always get that. I thought it was normal." My guest for this session is going to dive into what's normal and abnormal during the menstrual cycle, what could be some of those root causes of abnormalities, and what you can do about it. Teresa Kenny is a women's health nurse practitioner who has been practicing at the Pope Paul VI Institute for 20 years. Teresa is a certified medical consultant practicing the restorative reproductive health science developed by Dr. Thomas Hilgers called naprotechnology. Teresa is a member of the American Academy of Fertility Care Professionals and previously taught the Creighton Model Fertility Care System as a fertility care practitioner for 8 years. Teresa, hi, it's great to see you. Thank you for being here.
Hi, Anna. Thanks so much for having me.
Well, let's just dive right in, Teresa. Can you begin by reviewing for us what an overall normal cycle should look like?
Absolutely. All right, so normal cycle, and this is a common kind of starting point that I would have with my patients and kind of go through just like, what is the normal for you? And so when we start to ask questions about a normal cycle, we want to talk about first, like, what is the length of the cycle? And for most women, that's from period, the start of a period, to start of a period again. And so normal length of a cycle, average should be somewhere between 23 and 35 days. That's pretty typical. And a lot of people kind of fall in that 28 to even 32 days, which is very kind of normal, you could say. But there is that range. And then the second thing that we might ask is, what is, in terms of your cycle, the normal flow? So for a period, which is generally about a week, but most people would average anywhere from 4 to 7 days, we want to talk about how does that period act. So a normal period should have some sort of a crescendo and a decrescendo aspect, or it starts at a higher amount and then decrescendos. And so that can look like starting with a light day, then moving up to a heavier day, and then back down to a light day again. Or it could be that somebody starts with a moderate heavy flow and then trails back down to a light flow after, again, 3 to 7 days. So that's the second part. And in that, we're going to find out, is there any extra bleeding? Is there bleeding before the period or bleeding that trails on at the end of the period? So we ask questions about if the patient maybe has what they think is unusual bleeding. And then the third thing you might ask is, how heavy is your flow? And for that, that's a really subjective thing for people to grasp, because of course, heaviness is something that we experience in a way that is hard to measure. So for some people, heavy may be changing a pad 3 to 4 times a day. And for another person, heavy may be changing a pad every 2 to 3 hours. And so we really kind of need to ask a lot of questions about, do you saturate your pad or tampon when you change it? Or how often are you in the bathroom changing it? Do you ever leak through your tampon or your pad? So all of the questions, again, about is it a normal kind of amount of flow would be kind of the third parameter that we look at. And yeah, so typical for that would be just having, again, 4 to 7 days of bleeding, but you probably should have only 1 to 2 real heavy days, moderate to heavy days. And, you know, you're going to be changing your pad probably on average every 3 to 4 hours, which is about 3 to 5 times a day.
What's interesting to note there is there's a pattern for a lot of this. Is sometimes more important than the actual numbers, than the actual length, which is not always intuitive or what we understand in the mainstream.
Right. Well, and again, every woman is so individual and different. So for what's normal for one woman is a variant of what's normal for another woman. So we always have to really kind of reflect on how that patient and that person perceives is their period to be. Is it normal for them, or do they see this as abnormal?
Right, that's where, of course, cycle charting and long-term cycle charting can be super helpful because you really get to know your own patterns. So what, Teresa, is across the board considered abnormal? And I'd like to ask you about particularly during the period, but then also during different phases of the cycle.
Right. So, and maybe even to back up just a little bit, I mean, what's most important, I think, about understanding a normal cycle is that in order to have a normal menstrual cycle, you have to have a normal ovulatory event. So, of course, a woman actually only has a period because she has this other thing happen, the most important thing, which is the release of the egg from the ovary, what we call ovulation. And it's normal ovulation that will reflect in a normal period. And so whenever I'm talking to patients, it's always important for me to make sure that my patients understand that, because they need to know that the reason why they're having a period is because they have this other thing, the real main event, ovulation. And if something is abnormal about their period, the likelihood is that there's something abnormal going on with ovulation. And those are the kind of things that we need to kind of hormonally kind of flesh out as we're talking to patients. So first, in terms of like what could be abnormal, and we call this unusual bleeding. And these are the more, so there's the very obvious, I guess, abnormal, which would be, I don't have my period every month. I skip 3 to 6 months at a time. Obviously, to a woman, that's very easily kind of seen as this isn't normal. But there are then those subtle things that can happen in a period that are more abnormal, that maybe a woman like you referred to at the beginning may not realize that it's abnormal. For example, having more than 2 to 3 days of spotting before your flow actually gets going, the start of your period gets going. If you have spotting that lasts for 2 to 3 or more days, then that can be a sign of hormonal deficiency. It could also be a sign of a thyroid problem. It could be a sign of something physical wrong. And then on the tail end of the period, if a woman trails on and has, let's say, 3 or more days of even brown bleeding at the end of their period, that can also be a sign that there's a subtle hormonal abnormality, maybe in progesterone levels, maybe also in thyroid, and so some other things that could be wrong in terms of hormones. Some women will get bleeding just a little bit in the middle of their cycle when they ovulate, basically. So in their mucus flow, so in that discharge that women make when they ovulate, they might see a little bit of bleeding in that flow. And that can be due to a hormonal change. We call it estrogen breakthrough. And that may be not quite a concern, but it is something that many women will come in if it never has happened to them before. And they'll be like, I bled in between my period. I don't know what this is, and it really concerns them. So those are some of the a little bit more subtle changes you could see in a period.
Teresa, what about the different lengths of the cycle? What might be, like you mentioned, somebody who hasn't gotten their period in months, of course, is obviously abnormal. What about, the 40 days, or even in the particular phases of the cycle? Can you talk about those phases and what's normal and abnormal for the particular phases?
Right. So again, so ovulation, the main event, and ovulation is going to determine when our period starts. So it's really important to understand that the menstrual cycle is broken up basically into 2 phases. You are either before ovulation or you're after ovulation. And it's the ovulatory event that will determine when our period comes. So for somebody that has a very irregular cycle, their ovulation pattern is also irregular. And this can happen actually to, women who are playing sports, let's say, because their body is perceiving a certain type of stress that will cause the ovulations to be delayed. And so we see that in stressful times. We see that with patients who are very athletic. But the ovulatory event, again, it's basically all in your brain in a sense. So our bodies, our menstrual cycles, the primary way that the menstrual cycle works is by first in the brain sending messages down to our reproductive system. And we call this the pacemaker of the fertility system. And in order to have a normal ovulation, you have to have a normally functioning pacemaker, because that's telling your ovaries what to do. And so in a cycle, let's just say like day 1, again, first day of the period, and you have the menstrual flow, of course, occur with the first part of the cycle. But after that, the pacemaker is telling the body, the ovaries, to get that egg ready to go so that you can have this process, the real main event, ovulation. Now that is a very variable thing. So again, depending on what's going on in the woman's life, depending on where she will ovulate, is what we call not in stone. It's variable. So from the point she starts her period to the point of ovulation, that could be on day 10 for one woman. And then the next cycle, it might be on day 15. So it's not going to happen the same every month. And so that's why in the case of, you could say, women using natural methods to achieve or avoid pregnancy, they really need to pay attention to where their biological markers are, because ovulation, again, is variable in where it occurs. For example, only 14% of women actually ovulate on day 14, which was a common kind of myth that allowed for patients not to really understand their fertility well. So once ovulation occurs, and of course, what's the main marker of ovulation? It's cervical mucus. That's the most obvious thing that women can observe that tells them when they're going to ovulate, right? So it's predicting this event that's occurring. And so as they watch their mucus patterns, then they're going to be able to determine by charting that ovulatory event. Once that happens, then you have this like super stable part of your cycle. And that's the post-ovulatory phase of the cycle. From the point of ovulation until the point that next period begins, it's always going to be the same. And it's always going to be the same for each individual woman. And so when women get really good at charting and understanding their body, they can actually predict to the day when their period's going to start because of the stability in that part of the cycle. So going back to your question about what if a woman has like greater than a 40-day cycle? Well, it could be normal for her, but I would say that in actuality, we probably find more subtle hormonal disorders in patients who have longer cycles, greater than 30 to 45 days. And the most common thing would be something called polycystic ovarian syndrome. It's the most common women's health issue that we're seeing on a daily basis in our clinics. And you know, the cause and understand of why it's happening more frequently, we don't really know. But it often causes not just irregular cycles, but sometimes just longer cycles in women. And what's beautiful, again, about being able to have a woman come to you and chart is that she is very aware then of what's going on in her body. So she'll be able to be like, you know what? I used to have 30-day cycles, and now it seems like my cycles have changed, and I now tend to have 35 or 40-day cycles. And we can look and say, okay, well, what is different in your life? What are you experiencing in terms of symptoms? Are you breastfeeding? So there's just so much that can be gleaned by kind of looking into those intricate details of the chart.
I love how empowering that is, particularly for that luteal phase, that post-ovulatory phase, that it's so stable. I mean, think of all of the things that are variable and all the changes that go on in our daily lives as women and teen girls, you know, who now can rely on knowing their bodies and knowing when to expect that, you know, that little piece of our life that can be life-changing during the period. You know, we have to do things differently. We feel differently, right? But knowing when that's coming, I just think it is so incredibly empowering and one of the most useful primary benefits to charting, right?
Yeah, well, and I just spoke to, I think, over 200 high school students yesterday, and I use that word empower so much because I want them to know that they've been missing this beautiful information about their bodies. Like, sex education does them a disservice when it doesn't start with the gift and the beauty of how their bodies work. And it truly is like a sign of health. You know, we often, and I'm sure many people will talk about a vital sign that the cycle is to our health. And unless as a woman you understand your body, then you cannot be an empowered person to take control of how to talk to your healthcare provider about what's going on in your body. So it absolutely, I love the fact that we can educate and empower young women with this information.
Yeah, for sure. And I want to dive into particularly teen girls of what's normal and abnormal in just a second. But I want to ask first about because you brought up that main sign of cervical mucus as knowing the approach of ovulation. So can you talk about what's normal and abnormal, particularly on the subject of cervical mucus?
Yeah, and I would say, I think cervical mucus in some ways is even more variable in a sense from woman to woman. You know, there definitely is this is my mucus and this is how it looks, and every person is different in this area. But I would say there's obviously like a standard kind of pathway for mucus to appear in a woman's body. And so of course with ovulation, all of this is so beautiful because it really is a very, very great hormonal roller coaster that all women go on. And so as ovulation approaches, estrogen levels go super high, and that's what's causing this mucus to flow from the cervix, women should have at least 3 to 4 days of mucus, particularly when they're less than 35 years of age. Because as we get older, of course, things change. But a younger woman in her reproductive years should have at least 3 to 4 days of mucus. But it's even normal to have up to 8 days of mucus. And generally, that's going to be someone that progresses over, they'll start with a small amount of mucus. It may be a consistency that's more like hand lotion, or we call tacky, and then it progresses up to ovulation as those estrogen levels rise to be very clear, very stretchy, very slippery type mucus, and kind of looks like egg whites. That's the easiest thing that you can kind of describe to show people what that would look like. And then it's kind of like this magical biological faucet, right? So estrogen levels go really high, the faucet turns on, mucus starts to flow, right? And then all of a sudden that faucet just cranks back off. And so women notice this dramatic change that occurs in their cycle. And that tells them, again, when this main event, this ovulatory event has occurred. But yeah, 3 to 8 days, I would say, is about average for mucus. And it should kind of have a crescendoing type of look to it where the mucus changes. And essentially the mucus becomes like a very watery kind of, we call hydrogel, to be there to basically nourish sperm. That's the whole point of it. To be able to cause conception eventually. But so that, we want to look for the normal in that. And then so we want to look for also what could be abnormal in discharges. And this is something I think, unless you're charting your cycles, women are not paying attention to mucus, right? So this is where it gets really, really detailed then, because as you're like checking and charting your mucus patterns, you can really start to see the intricate details of that. And there are subtle things in mucus that can be abnormal. For example, I see a lot of patients that have kind of a damp discharge. So that can mean like they're just kind of going about their month and they just feel like a dampness or a wetness. That can be associated with bacterial vaginosis or another bacterial type of infection. Or let's say a woman notices a subtle kind of yellow discoloration to their mucus. Now that can happen around ovulation, just to a little bit of shedding of some red blood cells, but it also could be a sign of infection when it's very persistent. And also you can see sometimes people have an actual subtle green color to their discharge or a brown color to their discharge. All of those things, unless you're paying attention, are not very obvious sometimes. And those are the things that we can really now look and see, okay, is there infection? What's the health of this whole kind of vaginal microbiome, you could say, and making sure we're addressing those things as well.
Awesome. What could be, can you just briefly give an idea of what could be an underlying cause of somebody who doesn't see any mucus at all? Or somebody who has a lot of mucus, because I've seen that in my clients as well. Sometimes somebody can have a discharge throughout their entire cycle.
Yeah, so not having any mucus at all. So mucus, very important, right? It's the sign that a woman makes to show she's ovulating. If it's not there, why is it not there? So number one, we have to ask, is she ovulating? Because of course, if she's not ovulating, then she may not have that mucus because the primary or main event that causes mucus is not present. Secondly, there can be issues basically in hormones. So if a woman is ovulating, but it's not a healthy ovulation, so the estrogen levels are subpar, then estrogen, which feeds the receptors of the cervix to cause the cervical mucus, they're not getting stimulated enough. And so lack of estrogen or poor hormonal levels can cause poor cervical mucus. We actually have linked endometriosis to poor cervical mucus. So when somebody is very dry, we oftentimes want to look for symptoms of endometriosis, and even someone who has persistent infertility for years, just having dry cycles, that is a sign of possible endometriosis as well. And then also with the lack of cervical mucus, you can actually, and this is a hard thing to treat, but you can actually have problems at the cervical site. So you can have a receptor issue. So that could be also from a cervical procedure. Let's say somebody had an abnormal pap smear and they had a procedure done on their cervix. That can actually destroy some of the cervical mucus secreting cells, and that could cause some changes in the mucus patterns. And then we also know that even being on birth control can obviously change cervical mucus patterns, right? And we have found through research that actually there's a physical change that the cervix goes through on birth control that may make it harder for women to produce cervical mucus, even coming off of the birth control pill for at least a certain amount of time. So that research is out there too, in terms of what actual putting hormones into our body can do to the changes in cervical mucus. Okay, so then on the opposite end of that is mucus all the time, which can be a very frustrating experience for women, because it doesn't allow them sometimes to understand what's going on in their body if they have mucus every day. But this is probably the most common reason for excess cervical mucus. The cervix itself actually, basically, all the mucus secreting cells are tucked up inside the cervix. Sometimes they basically turn inside out, or evert, we use the word evert, to the outside of the cervix. And when that happens, you can get kind of a persistent inflammation of the cervix that causes an excessive mucus discharge on the daily basis. We can actually treat that by just observing the cervix, and if it does have this type of eversion or ectropion, then we can actually treat that and reduce cervical mucus for a lot of women. Of course, infection would be the second thing we'd want to look for. And this is interesting, you know, Dr. Hildreth, who of course started St. Paul VI Institute years ago, he had people stop charting once they were pregnant. But this is one of the things that he wishes he would have had people continue to do, is chart when they are pregnant, because we're finding now that there are infections that we can find in pregnancy by women really paying attention to their discharge. So again, going back to that kind of watery or damp discharge, we see chronic bacterial infections in that. And so oftentimes I'm culturing discharge to make sure we're not missing an infection. We treat an infection that's there, and you will definitely improve the cervical mucus pattern just by treating that infection. And yeah.
That's what I find so incredibly remarkable. As we've collected data over the last several decades, we don't know what we don't know. And so, you know, as more and more women are charting, we're learning more and more about how that can be a diagnostic tool for uncovering what's going on underneath. It's amazing.
Absolutely. Yeah, absolutely.
I want to switch gears back now, Teresa, and talk about what's normal and not normal as a young woman. As a teen girl begins cycling, you know, this is a time when the woman's body is just beginning to regulate an entire body system, and there's lots of changes and irregularities that appear. Unfortunately, I think these what may be even normal irregularities cause many teens and moms and healthcare providers to turn to things like the pill to make things regular. So can you talk about what is a normal irregularity, or what can be expected even in a normal cycle as a teen begins to start this cycling process?
Right. So going back to the brain again, so it takes about 4 to 6 years on average for the reproductive system to fully mature. So there is a lot of kinks sometimes that have to be worked out of a young woman's system in order to get it right. I mean, the menstrual cycle is such an intricate, detailed, complex hormonal event that's occurring. And in the beginning, women are starting, of course, as early as 10, 11 years old. And you can imagine as a young person's body, again, to figure that whole thing out is kind of a complex thing. So I would say there are quite a bit of normal irregularities that can occur for a younger woman. And for example, in the beginning, a lot of times when girls will start, that first period may be really long. It may be that she goes longer than a week. It also may mean she only spots for a few days. So, and even like a first period that isn't normal can kind of make women feel uncomfortable, or they don't have their period every month in the beginning. And that can be concerning, like why isn't it coming every month when she has started her period? But usually there's a lot of education and reassurance that can be helpful to young women to say that, okay, like, again, there's some things that maybe just need to be worked out. If they're not having any major medical issues, we can kind of just monitor for a little while. It's great. You can just, you know, have girls start tracking their cycles just by putting those bleeding days at first. And they can start, you know, initially really getting aware of what's really going on in their bodies. I had a young girl not too long ago come to me. She was 14, and she had been bleeding for about, I think it was about 21 days, a little bit longer. So she had a period, and then it just kept trailing on and trailing on. Her mom had taken her to a pediatrician, her own local pediatrician, and twice they were offered the pill to treat the problem. and they came to me for a second opinion. And this is a situation where, yeah, I mean, I think there's a lot of issues that are concerning, but you don't always have to use synthetic hormones right away. And so what we did is we looked at some blood work, and we, made sure there wasn't anything wrong. And then we just gave her some natural progesterone, and that cleared it up pretty much immediately. So there are less, I guess it's invasive, not invasive, but synthetic, you could say, in terms of disrupting the natural hormonal process, ways that we really can help these young women without going straight to the pill. And a lot of times, again, it just takes some education, so that mothers know that, again, working the kinks out of the system is okay. Bleeding a little bit more frequently is something that needs to be watched, but not necessarily something you have to jump right in and put young women on the pill for.
Yeah, thanks. So what about what would be considered abnormal always and should seek medical attention as soon as possible?
Yeah, I mean, there's certainly, concerning things that always should be evaluated. And number one, if somebody is bleeding and they're bleeding longer than a week, and that bleeding is heavy, and that bleeding being heavy means that they're saturating a pad, more than every 3 to 4 hours, even more than that, obviously would be something they need medical help for right away. But I would say also pain. So pain is never really normal. So when somebody's having concerning amounts of pain that's not being addressed with, a simple method like taking a Tylenol or an ibuprofen, women having pain really should be addressed. Pain with the menstrual cycle can be to some degree normal as like the first day of your period and cramps, but pain outside of that is not normal and should always be addressed. If someone is having persistent brown bleeding for days, that is something that should be looked into. So there are things, and it's always good to come in and talk to a healthcare provider like me, even though, we may not be able to, we may watch it for a while and just monitor for a little bit.
What about, Teresa, things like acne as a teen?
Acne as a teen. So in terms of the cycle and how acne affects, the cycle. So that's something I definitely would want to kind of look into in terms of the underlying cause. But I would say that I would never tell somebody that treating their acne necessarily has anything to do with treating the hormones of the cycle necessarily. Meaning that, acne sometimes has a lot of other underlying issues besides just hormones. I mean, we know that young girls break out, but it isn't always just the menstrual cycle that's causing it, which again is another reason why a lot of doctors will put people on the pill. But there are things like, taking sugar out of the diet, taking gluten out of the diet, drinking lots of water, and even some like herbal and natural things that you can do that really help with treating acne. So definitely something that I address a lot, but again, it's not something that I would, again, put a woman on the pill for. I'd really want to look at some of the underlying causes for that.
Yeah, just like anything else. That's great
Mm-hmm.
advice. Ask the questions of why it's going on. Can we move to the opposite end of the reproductive life? Thanks for talking through teen girls. And now we want to move to perimenopause as things start changing, begin to move out of that reproductive phase. What is abnormal and normal then?
Right. So very similarly, the beginning of the life spectrum of the reproductive, female is very similar to the end of the life spectrum of the reproductive female. So it takes on average about 4 to 6 years for women to kind of go through, you could say, perimenopause into full menopause. And those years can be difficult, I would say, in terms of the menstrual cycle. There are quite a few women that go through changes and that need to be addressed. For example, about 70% of women, well into their 40s will have some sort of fibroid tumors. Fibroid tumors are just benign growths in the uterus, and they often cause heavy periods. And heavy periods is a common issue as women are in their 40s heading into those menopausal years. So this is something that I address quite a bit. And I have found that, simple kind of things that you can tell a woman to do actually will make a huge difference. For example, heavy periods in the perimenopause years, again, super common. And if a woman can take ibuprofen and take it safely, she can take 800 milligrams of ibuprofen every 8 hours during her heavy days of her menstrual cycle, and actually reduce about a third of the bleeding in her cycle. And that, seems kind of crazy because I think people think, oh, ibuprofen is doesn't that thin the blood and it would cause more bleeding? But no, actually, the way ibuprofen works is that it's naturally bringing down what we call inflammatory chemicals called prostaglandins. And as you bring down inflammatory chemicals, which are there present to help the period happen, to help shed that lining, that you are actually taming a little bit of an overactive, you could say, inflammatory process. And so as you're doing that, just taking 800 milligrams of ibuprofen every 8 hours, really you're calming that kind of flow down. And this can be like just a huge lifesaver for women in the 40s when they're having that abnormal bleeding. But I've had situations where women in their 40s start a heavy period and then they don't stop. So they're bleeding, the week has, kind of gone by, and all of a sudden it's picking up again. And now they're into their second week of bleeding, maybe their third week of bleeding. Obviously, this is more serious and we got to worry about blood loss and anemia. But this is something too where I've been able to really kind of look at underlying causes, but also in terms of treatment, we can use, natural progesterone, bioidentical progesterone, and actually get that cycle back and recuperated, you could say, so that the woman can go back to having a regular cycle without using the pill. I've never, what's interesting is that I've been in women's health for 20 years, Anna, and I've never felt that I needed the birth control pill to treat a medical condition. And as a practitioner of health, I think that's super freeing. And I know not everyone necessarily is looking for that alternative, but there are certainly a lot of women that are. And what's great is like the more and more people that we have that really are charting and understanding their body, again, empowering them with the ability to take charge of their health, they're looking for these alternatives to not using synthetic hormones. And again, I just find that there is a way to really treat the underlying root cause of these abnormal bleeding patterns in every way without using, synthetic hormones to do that.
I find that so powerful that in 20 years of practice, you have not needed to use the pill. I know there's a big shift that needs to happen here. And it's people like you and a lot of other medical professionals and healthcare practitioners who are recognizing that this is not only possible, but it really is the healthiest and most effective way for women.
Yeah, and I think women intuitively know that, in this environment that we live in, when we're concerned about what we really put in our bodies on all levels, I think women intuitively know that taking a hormone that really wasn't meant to be in their body, that's not natural to their body, isn't the best route to go. And yeah, I just hope more and more doctors are able to learn this information and have a toolbox, you could say, to be able to provide answers for women. But honestly, it's really about getting to the root cause, because so oftentimes women are kind of brushed off when they come in with these abnormal bleeding patterns, when they come in with their cycle issues. So often they're brushed off and being like, well, all you have to do is just do this thing, take this pill. And no one's really getting to the root cause of their problems. And as any person who's a patient going to a doctor, isn't that what we want? We want the doctor to be a detective, and we want them to find what's really wrong in our bodies and to help us correct it. And so, yeah, I'm challenged every day on my life to, as a doctor, really figure out what's going on and making sure I'm doing what's best for women's bodies, for their health, and just really respecting them.
Yeah, one more piece that I might add is when we're charting the cycle, you may not even experience a symptom of an underlying issue that might be present, right? But intentionally charting the cycle could show things that could be going on. Maybe, hormones are low or something else is going on that could cause a more obvious problem later that we could treat. I just think of a comparison of cholesterol being off, or some of these other things, or some other vital signs that we can take that indicates well, there's something going on that could cause a real problem later, but I'm not necessarily experiencing any symptoms. Does that make sense? I think
Yeah.
there's a real importance of somebody might ask, well, my cycles are normal and I'm fine, like I don't feel anything, so why would I chart, in an intentional daily way? I think more and more that we're going to realize that it's a tool, it's a vital sign that we can do daily that could improve health or help to maintain health even before there's a problem. Does that make sense?
Oh, absolutely. In fact, I mean, I feel like this is very common in the 20-some-year-old female. You know, the woman who really has taken charge of her health, you could say, and maybe she's charting now. And she's going to come in and she's already wondering if is going to be able to have a baby. You know, I mean, I think it's just that, you know, if we plan to be a mother someday, then she's already looking at her fertility and is like, is that going to be possible? And so when we sit down with that woman and we start looking at her chart, and she's asking us questions about, why do I have this tail end brown bleeding? Why do I spot several days before my period starts? Why do I have all these mood changes before my period? She's worried about, in some ways, whether she'll be able to be a mother someday as well. And we can already be like, okay, so these are things that we can look at. We can start to kind of look at underlying things. Maybe there's nothing wrong, maybe there is, but already you're taking a proactive approach to your health. I mean, it's kind of like preconception planning. Like charting should just be a part of preconception charting, right? Because if we were all charting, we'd be able to maybe find ways that we could prevent miscarriage. Maybe we could find underlying thyroid issues that really affect a person's pregnancy. It's just, and just the basics of like helping women with PMS. You know, premenstrual syndrome it affects so many women. And if they're charting, I tell you what, when I was in my 20s, I had no idea that my PMS was related to like my cycle. I knew I had all these symptoms of anxiety and irritability and depression, but I wasn't charting. I had no idea that it was linked to my cycle. And then I started charting and I was like, mind blown. This is all related to a certain part of my menstrual cycle. So it really does allow this kind of window to be opened into a woman's body. And for us, I mean, as who are healthcare providers, it's amazing because you can't find a better diagnostic tool than a chart. You know, it truly is a very intricate, detailed diagnostic tool that women are giving us by giving us this information about their body.
Yeah, and I think the more we can change the conversation around this whole thing, the menstrual cycle and the periods and everything, rather from something that is barely tolerated, you know, or is annoying and all of this, but that change the conversation toward this being a tool and a vital sign and something that truly is empowering for women. So Teresa, I want to thank you so much for all of this information. Thank you for all of the work that you have done for women over the past 20 years. You're incredible.
Thank you so much, Anna. Thank you so much for having me. I really appreciate it.